Hello everyone. So this video is all about seeking help, finding the right help as you recover on the journey to recovery with anxiety, because it's something that most people will do at some point. Most people will absolutely find someone to help them, hopefully recover, hopefully get some really good support along the way. The problem is that all help is not equal. And sometimes many people find, unfortunately, that the people they see, the help they get is actually really unhelpful, sometimes triggering, sometimes alarmist, and it gets you taking the anxiety state even more seriously than perhaps that you were before. The problem is we trust these people. We trust these professionals who are there to help us, and so we're already vulnerable to their words because we have an expectation that they're going to help or potentially fix us. So I'm going to talk specifically about just general therapy counselors, coaches, if you like myself, psychologists, psychiatrists as well, just to give you a bit of a whole overview so you can assess where you're at in terms of seeking help and make more informed decisions about what you want to do. First thing is that it's normal that we all want to seek help because we're hardwired as human beings to connect. It's great to share your problems, get out of your head, help see the wood through the trees, get perspective on where you're at. If we've got too much time on our own, we're thinking, we've got raging thoughts, worries, etc. Just simply talking to someone can help. We all know it. We all feel the benefits from it, whether we've got anxiety or not. So it's something that a lot of us will leverage, but can we do it in the right way that's going to really help us recover? So that's the first thing. It's normal, and we're kind of hardwired to do it. We're pack animals, if you like. We like a pack around us. We like to talk to people. So I do encourage everyone to seek support, not to help, not to find someone who's going to cure you. The only person that can ultimately make you recover is you. So that's the first thing. No psychologist, counselor, therapist is going to cure you. It's you that will ultimately cure you. But if we put that aside, I've talked about that in other videos. Let's talk about, who's going to be the best person to help you. I personally saw a psychologist, I think probably for over a year, as I was kind of figuring out my journey. I was living in the UK. I had no one really to talk to from a family perspective. I was a little bit isolated. So I found her very, very helpful, not because she actually gave me the tools specifically for recovery, but she wasn't alarmist. She didn't add to my fear. She was actually reassuring. I didn't get the understanding I have and now I share in all the videos, but she was just a great sounding board and reassuring. So she would never have used these words, but I suspect she didn't think anxiety was serious as maybe some other professionals do. But she gave me that time and space to figure out my own journey. So when I discovered these tools for myself that I now talk about, people like Claire Weeks, Eckhart Tolle, and others, the David Johnson program I've mentioned before that I used, I was able to talk about them with her and talk about how I was applying them. So that was really good. So it wasn't because she was a psychologist, it was because she was just very open, reassuring, calm, and gave me the space to talk, figure out my own way forward. So in some ways, it doesn't really matter about the profession. It's the person that you want to judge or assess in terms of their ability to potentially help you recover. So given I'm talking about psychologists, I will start there. So what do psychologists do? Well, I'm talking about my understanding of psychology in Australia and the UK where I lived. I did study a psychology master's in Australia, so I do have some understanding of what psychologists do. Obviously, I've seen one myself in the past. But psychologists can be really helpful or really unhelpful. A lot of clients come to see me to help recover from anxiety after they have had no luck with psychologists. There's different types of psychologists, just to make it even more confusing. There's clinical psychology, which is trying to align to psychiatry, which is more about brain chemistry, psychobiology, the connection of chemicals to the brain functioning, serotonin, all that sort of stuff that we hear about. So they tend to be a bit more, they're trying to align to the fact that anxiety is a mental illness. Now, not all, this is a generalization, not all align like that at all. So I don't want to make inaccurate statements, but a lot do. So we're sort of coming from the fact that anxiety is an illness. And then, so a lot of people who see psychologists may also be on medication. Nothing wrong with that if that's what you're doing. But is it going to help you recover? Is it going to cure you? No. Medication, generally, at least in my experience, I haven't spoken to a client who has recovered using medication. A medication is used to help people maybe manage it and keep it at bay. Psychologists don't prescribe medication. They don't have a doctor's degree. That's psychiatrists. So some people might see a psychologist to work through talk therapy, to use cognitive behavioral therapy, so challenge their thoughts, their unhelpful thoughts, etc. Psychiatrists might do a bit of that as well, but their primary mode, psychiatrists that is to prescribe medicines for your condition, for your so-called mental illness. So they probably tend to think that there is some sort of chemical imbalance or brain dysfunction that needs to be corrected by some pharmaceutical drug. Now, that's again a generalization, but that's what a huge perspective of psychiatry is. So that's psychologists and psychologists. Some think similarly, some think different. There's a lot of non-clinical psychologists, such as counselling psychologists, who are more about the talk therapy. So let's go into your past. Let's understand what happened in the past that maybe triggered your anxiety, that caused your depression. I talk about that being useful to really understand your journey, all the stress that's accumulated onto your nervous system that's now put you into high alert, that's put you into this anxiety state. So a lot of psychologists will tend to go there to understand it. They might have tools available, such as cognitive behavioral therapy as well. I'm going to do a separate video on that because that's quite a specific methodology. Acceptance commitment therapy. Generally speaking, those have nice principles, but they are problematic in my view when it comes to implementation, and I'll talk about that in another video. But regardless of what they're doing, it's talk therapy, but the problem can be that we never move forward from that. We talk about the past, we understand it. We're like, well, I get it now, but how do I recover from it? And a lot of psychologists don't necessarily know how to help people recover. They just talk about, generally, you've got to think about your lifestyle, do some meditation, do some breathing, without really, on a deeper level, understanding what anxiety is and why people can't stop worrying. Even if they're doing the breathing, they're doing the exercise, their lifestyle's okay, they're still taking anxiety seriously. They're still reacting. A lot of psychologists don't make the connection between this overactive fight or flight response tricking you into worrying about your thoughts. Some psychiatrists don't really understand that. I do a lot of work with doctors. A lot of doctors don't understand it as well. So it's very interesting when you sort of dive a bit deeper. So the question for you, regardless of who you're seeing, is for you to think about asking open-ended questions to the person that you're seeing to see if they really understand it. You know, if you like the stuff in my videos, can they explain anxiety to you in a way that you accept and understand? If they can't, then I'd say perhaps proceed with caution. If they can't explain to you what anxiety is, why you have it, and potentially what to do about it, then, I would say maybe they're not going to be as helpful as you might think. So it's up to you to ask questions of the person you're seeing to see if their offering is going to help you or not. Are they going to let you explore your own tools? Are they going to let you go on your own journey? Or are they going to be giving you, less helpful information? Are they going to try and push you down the medical pathway? Or, it's up to you what you think is good for you. But often we just accept what people are saying without question because we feel that they've got some expertise that we just have to accept. They know more than you, but you know yourself better than anyone else. So I'm encouraging all of you, all my clients, all of you watching to become your own expert in this. Therapists, that includes a whole range of people, counsellors, coaches like myself. I do have, obviously, studies in psychology as well, so I understand what goes on there. But it's different for everyone. So people have different modalities, different programs, theories, etc. So again, I just ask you to ask them open-ended questions about their approach, how they describe anxiety, why they think it, what they think it is, how serious they think it is, can you recover from it, to get their perspective so you can assess if you feel that they're going to be helpful. If you've found methodologies, tools, and understandings, such as in my videos, um, then, and if they don't align to that, is it going to be helpful or not? Do they align with people like Claire Weeks? If you think what she says works, do they and are they going to allow you to explore that, or are they going to send you up a potentially different or more confusing pathway? So that's kind of, a difference between everyone's got between all those different modalities. Everyone's got slightly different qualifications. Again, it's less about the qualification, but what information they're giving you and what you get out of it. So I'm really encouraging you all to be on the front foot and take control of your journey. As you know, my approach is based on the education and the methods in all my videos. So if you do a coaching session with me, at least you know my approach before you even come to see me. It's not rocket science. So what I do with clients is I allow them the time and space to talk, get out of their own head, to talk about their challenges in applying the methods I talk about, to close gaps in their understanding, but ultimately help them take control of their own journey, to practice their way to recovery, while giving them some reassurance and support and reminders along the way. It's a big topic. I probably haven't covered everything. So if there's questions about different practitioners that you want me to answer, let me know. If you're stuck and you do want to book in a coaching session with me, there'll be a link in the video so you can do that. But please, again, let me know if you've got any questions or you get stuck with anything. I'm always happy to help if I can. Okay. Hope to see you again soon. Take care.